Okay, so I want to talk about Hippa and violations of Hippa. Um, First, I want to go ahead and speak of what and who is protected under Hippa, our Hippa rights, what it means for unauthorized disclosures, overview of my case study, which is somebody or persons stealing a thumb drive, the prevention that we could have stopped to do this, and then the following up procedures that have come out of this case. So, what is HIPAA? HIPAA it's the abbreviation for Health Insurance Portability and Accountability Act of 1996. What this means, it's a law that protects patient confidentiality. Medical centers are able to do this with security in place. Right now, into our electronic systems is what we're going to be focusing on. The example that I'm going to use is encoding or using the required electronic transmission of health records. Who does HIPAA protect? It protects us or our patients from information that is shared with third-party providers or within other healthcare providers. Information that's stored within our system, such as a facility or a patient files, paper or computer, verbal or written information in the facility or our third parties. What does this mean? This means that we have to think about when we're speaking to somebody outside an elevator, a hallway, or something like that, to not give information out about these patients. Somebody may have a family member there, brother, sister, mom, dad, and we need to keep this information confidential. So we don't need to be talking about a patient we just did surgery on or one who has tested positive for anything. So again, it's anything that's personal, including confidential, their name, their photo, their address, their social security number, medical records, even numbers. That the only people who need to know as far as billing or something that's actually pertaining to these people's health. What rights do we have when it comes to HIPAA? We have the right to privacy. We also have the right to access any of our billing info, medical, or anything else due to that. To not to have somebody involved in the medical facility involved in our own health care. The right to have our name withheld. Also to have the ability to request our own information. Unauthorized disclosures. This is kind of what I touched base about just a couple minutes ago. And this is things like discussing a coworker about a case where other people can overhear, or leaving sensitive information where unauthorized people can obtain it, which is going to start leading me into my case study. My case study has to do with a staff error exposed 33,000 HIPAA records at St. Joseph Health. How? What can we do to prevent it? Now let's follow up furthermore on this. The facilities were broken into on this specific occasion. They're not sure if it was one or more thieves, and they managed to gain a thumb drive. The hospital, this was based on the radiology department, and the only reason they even had this going was because the hospital was going through some major construction. So for some reason, this specific hospital thought was a good idea to put temporary patient files in the radiology department on a thumb drive. But the problem was none of them were encrypted. So the employee who had this specific thumb drive decided to put it into an unlocked locker as well. We can think our little bits and pieces about it, but this is what our story is being told. So even though it was temporary, somebody was able to get in. The only reason they caught them or caught the fact that I was even missing is because the employee, when they went to their locker the next morning, kind of stressed out a little bit, seeing that wasn't there. So with that being said, all these patients' information was viable. They could not say that any of this was used to hurt these patients. They couldn't find specifics on it, which I looked. But we come to a fact of this was not the first time that this has happened to the hospital. We have cases in 2010, burglary office at St. Joseph Heritage Healthcare, 22 computers stolen. Also, nothing was encrypted. 2013, a theft of unencrypted electronic device data, 1,000 St. Joseph's Health patients. In 2012, more unencrypted devices. We're kind of seeing a pattern here. With that being said, we come to what we could do to prevent this from happening. Well, obviously stated, encrypt the data, better security systems, lock your items, educate yourself, your staff, have a plan. The president of the company apologized, which she should, but we immediately heightened security measures and training for our new Soto Time Drive facility. I think that should have done after the first couple times somebody broke in and did this, but it is how it is. I put on a little saying from some that most people have heard from Britney Spears. Oops, I did it again. Many people were upset about it, and so they got looked into a lot. St. Joseph Health agrees to 2.14 OCR Hippa settlement. I don't know really how much that makes them feel better about that, but we do have to pay for our mistakes. I could not find anything on the employee as far as what he goes, but the hospital had to pay. HIPAA is a major violation and something we have to take serious. For this one specific St. Joseph healthcare system, I don't know if they actually took that serious, and now they are going to be paying for it, and I can only see in the future that there's going to be more lawsuits for it. Thank you for listening.